well, I am sitting down today with Damien Berg, Vice President of Strategic Initiatives at HSPA, and we have just wrapped up the NeXus conference, and you were here joining us for a panel presentation on meaningful and practical IFUs. And one of the things that came up during your session was the importance of including the voice of the customer. So from the perspective of reprocessing instructions in IFUs, that really means sterile processing technicians, which you're here representing.
Yes, and first of all, thank you, Amanda, and thank you, Amy, for inviting me to speak at this conference. First time being here.
First time having it.
Well, there you go. That's I like how that works. It was a very unique presentation because we actually got to have from the manufacturer of medical devices, regulatory folks who approve the IFUs, and people who actually help write the IFUs, and then the people who have to implement the IFUs, all sitting together on a panel discussion to say, here's the commonalities, here's the challenges, here's what's good, here's what's opportunities for improvements on these kind of things. But every time I do kind of these talks, I learn so much more about the IFUs and the process and the regulatory and the reasons why sometimes it's challenging for our members and our end users who are reprocessing medical devices, because it's not just, you can't make a medical device or an IFU for a facility. Mm-hmm. And you also have to look at the process that the FDA has, as well as the device manufacturer. But what's really encouraging is, for probably the first time I've seen in my career, there's really a great open dialogue to say, are we doing it right for all parties that are interested, not just the device manufacturer or the testing lab or the regulatory people. They're bringing in the voice of the customer, the voice of the end user. But at the same time, the end user has to have an open mind to go, okay, now I see why that's that way. Mm-hmm. It can't just be about, well, this is how I do it in my facility, so make the IFU work for my facility. It's got to be a universal thing, which is very challenging to align all IFUs to all practices out there in the market. So it's encouraging to have these conversations, but it's very encouraging to have the voice of the customer come across to people who probably not had a lot of opportunity to hear the sterile processing professional side of IFUs.
Right, and I think that was a really important theme that came up this week. It was not just collaboration, but it was learning from different perspectives. So, really engaging a broad array of stakeholders in conversations to ultimately improve the medical devices, improve their use, and improve outcomes for patients. So what was one of the key takeaways that you had from listening to the regulatory representatives or from listening to the MDMs as far as IFUs are concerned?
So, I have a different perspective or a different lens I look through things just because of my job and the experience I've had working with Amy and then on the global scale. But the interesting and fascinating thing was to see the challenges on that global scale of our international partners and their national partners, our U.S. partners, to say, I sell a product in country X, but I also sell in country Y. How do I align my IFUs across the board? So there's an effort, but you still have the vast challenges of governmental laws and regulations and things that change. I know that, I sat through a presentation of all the different regulations and guidelines that the UK is going through, and it's mind-boggling, and thank God that we don't have that. We have our own challenges, but they're different challenges. But listening to those perspectives I never would have actually had the opportunity to hear was very good, and also talking to manufacturers that go, oh, you are the people who reprocess the medical device. And again, you may make a great medical device for the patient and for patient care as well as the provider, but did that medical device, is it a reproducible, reprocessable item that can be done with the ethic and the attention to detail that's needed? And that's really the sharing of those kind of common knowledges and challenges was really needed.
And that's the practical side of things. Can this be done? Is this feasible? So what is one thing that you would really like to impart back to the MDMs and the regulatory bodies from the user perspective, from the clinical perspective?
Get the voice of the customer early on in the process of designing that medical device, because you spend a lot of time and a lot of money and a lot of effort to design this product, but if you're not engaging with the sterile processing community early on, then but you get to a certain point where you just got to move forward with your device. But if you didn't get that, it's kind of tough, because I feel bad. I meet with a lot of them, and it's like, oh no, we already passed that stage, and you're like, oh, how'd that happen? But I think what really imparting on the people outside of sterile processing is understand the product and it's processed in the real world, not in a simulation lab, not in a testing lab, not on a piece of paper, but actually what are the process flows of sterile processing, what are the equipment that we use, what are the cycles that we use, and how does your product fit into all those equations in the real world. And I think that's the secret sauce that we're really imparting to the medical device manufacturers as well as the regulatory folks. And I'm encouraged because for the first time, again, I'm seeing the ask from these people to our profession through HSPA and other ones like myself to go, well, what is that? What do we need to know? And they haven't asked that in the past. Now they're asking it. So the tide is changing, and it's really encouraging.
Yeah, some more collaboration, and the more you know, the better the outcome is for everybody.
Well, and that's why it's important to be here, because you just can't sit in your hospital or you can't sit in your office. You got to actually engage with the people who then will hopefully take this information, these learnings back. I know I will, and I'll take it back. And when I go talk to our members and my other professionals, I'll share the other side of the story. So hopefully that's going to be in these continued dialogues is what makes it also important.
Absolutely. Well, we look forward to that. So Damien, thank you again for being here.
You're welcome.
Good to see you as always.
Thank you, Amanda.